And in terms of our public schools and our little ones, I want to talk a little bit about shame. Imagine being age 11, and either directly or it's implied, hey, your mom, your dad, they're systemically broken. Your great-grandma and great-grandpa or great-great-grandpa, they were slave owners. And because of them, I can't get a job. And as someone said in the back, you're bad. That's shaming. There are psychological underpinnings for the impacts of shame. I'm going to read. This is from the Journal of Anxiety Disorder, Shame and Guilt Proneness, Relationship with Anxiety Disorders in a Clinical Sample. Here's a snapshot from that. Internal shame seems especially relevant to both social anxiety disorder and generalized anxiety disorder symptoms. Remember that. Social anxiety disorder and generalized depression. From the Journal of Personality and Individual Differences, a snapshot from there. Their main point: how individuals cope with feelings of shame is an important predictive factor for depressive symptoms. And the final article here that I got from that conservative school, Harvard School Public of Health. Their snapshot. Both shame proneness and guilt proneness were significantly related to higher levels of both PTSD symptoms and somatization symptoms, whereas only shame proneness was significantly related to higher levels of psychological symptoms. Shame brings on anxiety, which can bring on major depressive disorders, and those are the foundational basis for suicidal ideations. Our town in Utah, we have the 4th highest suicide rate between the ages of 11 and 17. And that is based upon anxiety and depression. As I talked about the Hippocratic Oath of do no harm, no matter what your school board does, you need to make sure that it does nothing to increase a child's anxiety or their level of depression. And shame is the number one and a very powerful way to bring on anxiety and depression, which just is another way of saying that's a very powerful way that you can be pushing your kids to suicide.